Good evening. I'm Lee Thielen with the League of Women Voters. Welcome to the League's Candidate Forum for the 2014 election of the Health District of Northern Larimer County. There are 5 candidates and there are 3 positions available. And this is a nonpartisan election. There are no parties, no primaries, no PACs. It's good people in the community wanting to do good work for the community. Before getting started, I'd like to thank the League's voter service team for organizing the forum. They do fabulous work, and also the City of Fort Collins, which is filming this forum live tonight, and it will be rebroadcast on Channel 14 multiple times before Election Day. First, a quick word about the League. The League of Women Voters is a nonpartisan political organization that encourages informed and active participation in government and influences public policy through education and advocacy. We're very pleased to sponsor this and other candidate forums. Now about the Health District. The Health District of Northern Larimer County is a unique organization. As I said, it's a special district. It is supported through local property taxes to serve the residents of Fort Collins, LaPorte, Timnath, Wellington, Livermore, Red Feather Lakes, and other unincorporated areas of Northern Larimer County. Services include such things as prescription assistance, preventive dentistry, mental health coordination and support, and health planning and policy. The district was created by the voters in 1960 to serve health needs of the people in our Northern Larimer County community. It is governed by 5 publicly elected board members who serve for a 4-year term. The district is a very important asset to Larimer County. And again, tonight we have 5 candidates and there are 3 open slots. The Health District election takes place on May 6th. You can vote at the Health District office at 120 Bristol Cone Drive or at the Spirit of Joy Lutheran Church at 4501 South LeMay. Mail-in ballots, of course, are much more convenient for many of us, and they are available either by asking at the district, or if you've submitted an application for permanent mail-in voter status, you can contact the district for an application. A copy was provided in this month's The Compass, which was in the Coloradan if you get the local newspaper. It can also be downloaded from the website of the Health District. Mail-in ballot applications must be returned to the Health District by May 2nd. If you'd like your ballot mailed to you, all ballots must be received by May 6th at 7 p.m. Again, May 6th at 7 p.m., and you can vote on that day. I just found out something very useful, which is a regular stamp, a 49-cent stamp, is sufficient for your mail-in ballot. I always have that question myself. The candidates run at large. In other words, they represent the entire district. And the successful candidates will be filling a 4-year term. Candidates are in alphabetical order, and that's the way our candidates are seated tonight. Tess Heffernan, Mike Leggett, Clarissa Morrison-Heffern, Tracy Nelson, and Rob Phillips. We'll begin the evening with each candidate taking 2 minutes, up to 2 minutes, to tell about themselves by answering a question about themselves. And there will be a timer who will be watching for the time. When you see a 30-second go up, that you know you have 30 seconds left. So the first question, and we will start with Tess, is why are you running, and this is a 2-minute response, folks. Why are you running for the board, and what skills and experience do you bring to the position?
Thank you, Lee.
Mm-hmm.
I've lived in Fort Collins since 1981, and my professional career, my entire life, has almost exclusively focused on community. I worked for the police department for many years. I did disaster preparedness. I started back in the 90s, the Neighborhood Resources Office, and that was all about helping empower people at the neighborhood level to deal with issues that were important to them. As part of that, I started the community mediation program. I later went on to become a project manager, and I facilitated so many task forces on issues I can't even number them. I like doing analysis. I like bringing people together to build consensus, and that to me is the best way to deal with complex issues. I retired a couple years ago, and I heard about this opening on the board recently, and I thought that would be a really nice fit and way that I could give back and contribute. The Health District has many, many challenges coming up. I mean, there always are issues and always are challenges, but with the Affordable Care Act, with our aging population, With just the need that always outstrips the resources, it's going to take good minds to come together. And I would really like to join the leadership team, and I think I could contribute.
Thank you. Mike?
Good evening, thank you. My name is Mike Liggett. I've been a lawyer here in Fort Collins for the last 35 years. Lived in Fort Collins since 1963. It seems that public service has been part of my DNA over my career. I've served on the Board of Education, currently on the Library District, have been involved in other community service sorts of things. The reason I would like to get on the Health District Board, I think I have two answers to that. And one is more broad, more overarching. And that is my observation and belief that the best intersection between government and the citizens is at the local level. I think that's where we have an opportunity to assess what our citizens need, what the soft spots might be in our community, and then respond to that with our resources in an effective way. And the Health District is that sort of place. I think the Health District has proved itself with regard to its ability to assess the needs in our community and has tried to respond in ways where it can bring the greatest good to the greatest number of people. And I would like to bring my energy and thinking to that process. Thanks.
Thank you. Clarissa?
Hi, my name's Clarissa Morrison-Heffern. I am a certified geriatric pharmacist. I work here in Fort Collins, Windsor, Loveland, and down in Greeley. I go into several different nursing homes and just do chart reviews, make sure patients are on proper medications. There's a lot of emphasis on psychiatric medications right now. There's a lot of changes in the federal government and their regulations that's changing a lot of the focus on psychiatric medications and how you treat people with psychiatric illness. So I have a passion for the elderly and I have a passion for mental illness, and that's why I'm here. I think both of these groups of people they have a difficult time speaking for themselves, and I don't think that there's enough of a voice out there for them. And I'm very passionate about it, and so I'm here to be their voice.
Thank you. Tracy?
Hi, I'm Tracy Nelson, and I'm currently a professor at Colorado State University and also the Associate Director for the program in public health, the graduate program in public health at CSU. And so I've been working at CSU for about 15 years now and have had the opportunity to have a lot of different viewpoints about public health, from being a teacher, doing research, service, as well as now being an administrator with the graduate program. So I think it's given me a unique perspective, and I'm really excited about sharing the skills that I have with the health district and the community at large. I have a passion for the community as well. I did my undergraduate at CSU, went away for graduate school and came back. So I'm passionate about the community and excited about some of my skill sets that I think I can contribute.
Thank you. Rob?
Rob Phillips, and I'm a Fort Collins native. And after I went to law, an attorney as well, and after graduating from law school, I moved around with a couple different communities for work purposes. And the longer I spent away from Fort Collins, it just really convinced me, and I came home a lot, just what a wonderful community we have here. And this really is an incredible place. And because of that, and because of my interest in giving back, I have been fortunate to be able to, through my practice, spend a lot of time working with nonprofits and giving back to the community, and I think that's very important. I've got a healthcare and regulatory background, healthcare law, and so I've got a lot of experience in that area, as well as I have served on several boards. I've served on some boards in the past, as well as with my position as in-house counsel. I've done a lot of work with board governance and helping guide different boards of directors as we work through issues. So I've got the experience to understand healthcare law and analyze it, as well as regulations in general. And I think that background and those skills, along with my interest in giving back to my hometown, will make this a great opportunity, and I look forward to the chance to serve if so elected. Thank you.
Thank you. Now we're going to move into the question portion of this evening, and you will each have 1.5 minutes. It'll be the same question for every member of the panel. And keep in mind that after that question period, you will have a minute for closing remarks too, so please have that at the back of your mind. So we're going to start with Mike for the first question, and then we will go around. How should the district determine priorities for service in the community?
As I mentioned in my opening comments, I think one of the strengths of our health district is its assessment function, where it looks at the community and makes determinations as to need, and takes that need and overlays it over their budget to see if they can effectively answer or provide services in those areas of need. To prioritize that, from my perspective as a member of the board, I'm going to be looking to the administration of the health district. Those are the experts in that field, and I would look for recommendations and comments from the administration with regard to prioritization.
Okay. Clarissa, would you like me to repeat the question?
Please.
How should the district determine the priorities for service to the community?
I agree. I think it's important to look at the community as a whole and to see who has the greatest need for health services. In my experience, from what I see, there's a great need for the elderly. The elderly population is growing at a huge rate, and I don't think that people necessarily know what to do with that. And so I think that's really a focus of the community right now. And I also feel like that with mental health, that a lot of issues are starting to pop up within not just our community, but every community. And so I think that the board needs to look at a whole in the community and what largest groups would benefit from decisions that the board makes.
Tracy, would you like me to repeat the question?
No, that's fine. I think in terms of prioritizing what the health district does, I think it's an exciting year in that last year the community health survey was done in the community to assess what the community thought the needs were. And I know this year they're going to be reviewing that at the retreat. And I'm trained in epidemiology, so I love data. and figuring out how to best use data and see what the data is telling us. So I'm excited to hear what the community says our priorities should be, listening to the community based on that survey, and then looking at the resources, and maybe even merging that with the Colorado Department of Public Health has their 10 winnable battles, our 10 most winnable battles right now, and obesity and mental health and substance abuse and clean air and clean water, all those are in that. And I think really tailoring that to our local needs and using those priorities to help us tailor some of those needs along with the community health survey will be a good way to prioritize those things.
Thank you. Rob?
Thank you. I think one of the key issues that we'll need to look at is to minimize, to the extent we can, the disparities between the different socioeconomic levels that we have, because currently there really is a great disparity between the health needs and the health care that people are receiving at the different levels. So I think we'll want to focus on that to a certain extent. I think one of the other key points will be we would want to utilize feedback from healthcare professionals and the healthcare providers that are out there, because they're the front line, so to speak, and they can give us a good idea of exactly what issues they're seeing and where we need to focus to a certain extent. I also think that, certainly I should say, changes in federal law and to some extent state law are going to dictate the direction we head as well. And finally, I think another key point, we've got a relatively new collaboration with University of Colorado Health, and like any kind of large joining of forces such as this, it's going to it's going to take a little bit of getting used to and to help bring everything together so they flow as smoothly as possible. Thank you.
Tess?
Well, it's always hard to go last because many of the points that I would make have been made. I would underscore that I do think we need to look at both the quantitative data, the information that comes from the surveys, but also the qualitative, the information we get from talking to our partners. One of the things I like about the 3-year health assessment is that it hits both of those sides. And then there's also a component to look at best practices. So when we're determining our priorities, we should take all of that into consideration. Also, the health district provides a very specific, can fill a very specific gap. We don't need to duplicate services that are being done by the other healthcare providers in the community, be it our mental health care providers, the hospital systems. We now have Banner coming in, as well as University of Colorado Health. So I think we need to attend to those things that would fall between the cracks and make sure that we look at that. And lastly, I would like to underscore what Rob said about the disparities. I was just looking at some data just this week that I was really surprised to see how in our wealthy community, we have a couple areas of town, if you look at it by census tract, that have an incredibly high number of people that are still uninsured. And that might change with the new enrollment, given that there's so many more people now eligible for Medicaid. So we don't know exactly what that's going to look like yet. But I think we really have some work to do. These are some of the same neighborhoods that I remember going into 20 years ago as part of the city and doing some work there. Thank you.
Good. We're going to start a new question now. Clarissa, you'll be the first one. And this question is, what role should the district play in access to care issues?
I think it's important for the community to know that the board exists. I don't think that the health district or the board necessarily promotes themselves as much as they should. And I think it's important that people know there are places to go to ask for help, and that there are a lot of knowledgeable people around that would love to help them. So I would really like to see the board be more accessible to the public, as well as like the health district as a whole.
Okay, good. Tracy, again, the question, what role should the district play in access to care issues?
I think continuing a lot of the things that they've been doing, the dental care, the mental health care, the prescription assistance, I think that increases access for a lot of people currently, and I think that potentially those might expand in the future depending on how the Affordable Care Act plays out, and hopefully we're going to increase access to care, but I think that gaps will be created initially with the Affordable Care Act. We've already talked a little bit about the Medicaid expansion. I think that's been talked about in the news a lot, and a lot of physicians aren't necessarily taking Medicaid patients, so are there going to be more people falling through some of the gaps there? But I think there's been a lot of good work that in terms of increasing access that the health district has done, but I think it'll potentially change with the Affordable Care Act. So,
Rob, would you like me to repeat the question?
No, thank you. This is certainly an important role for the district to fill, and I think it's something that should be in the forefront, because for those that have access, there are plenty of opportunities for them, and so the focus really needs to be on those that do not have the access, and in many cases that are not aware of the opportunities that are out there, such as the programs that have been mentioned before, such as the smoking cessation, dental care, that type of thing. There will continue to be gaps even with the changes in the law with Medicaid, and as Tracy properly mentioned, there remains problems with doctors, the number of doctors and the opportunities for people on Medicaid to get the services they need. So I think it's very important to continue to make sure that the access to health care is provided for all of the citizens of this community. So thank you.
Good. Tess, would you like me to repeat the question?
No, I thank you. One of the best ways for people to get healthy is to make sure that they have insurance. I think a lot of people don't seek care because they feel they can't afford it, or when they do, they go to the most expensive provider, the emergency room. So I think that the district has done a phenomenal job of helping people get insured. The whole program, Larimer Connect, to help people get enrolled in health insurance. So I think more of the same. I mean, I really feel like we're very fortunate to live where we are, and that there's been a really good job done to forward that goal. I think there's probably more work to be done. Again, I'd like to see the numbers. I'm excited to see what the survey results say. But I also think the other piece that district does a great job is on awareness. The Compass newsletter goes to every household in the district. That's fabulous. And so the more that we can do to help people become aware of the services that are out there is a big part of it.
Mike?
So I get to summarize what everybody else has already said.
If you like.
And I agree largely with what everyone has said at the table here. It's really kind of two functions. The first is information. We can get information to people about where they can get care and how they can pay for it. And the other piece is we can help facilitate that, like the Connect program, where the district put in hours and hours and burned the midnight oil getting people signed up under the Affordable Care Act. So those are the two big components. And then, and it's not one, I'm not sure how the resources play in, but then fill the gaps with the screening programs, the dental programs, where we can make the biggest impact across the broadest population. But largely, I think it's information and then facilitation.
Thank you. Okay, our next question, and we're going to start this time with Tracy. How should the district work in partnership in the community? Who might the key partners be for the district?
I think CSU is one currently, and I'm excited in my role at CSU and with the School of Public Health, which is a multi-school, multi-university school, University of Colorado, UNC, and CSU. I think there's a bigger role we might be able to play with Colorado State University and the Health District. I know there's ongoing collaboration. The list I've seen, there's a long list of partners. I think, CSU stands out obviously as a big one. The Touchstone partners, all the connections with the mental health groups, the primary care physicians that are currently existing, I think are important. It's harder when you don't have time to get ready. So, yeah, that's all I'll say right now.
Okay, good. Rob?
Yes.
Partners.
So, I'm sorry?
Partners.
Yes, thank you. First of all, I think one of the critical relationships and partnerships to focus on is the independent healthcare providers that are still in the community. You know, many are certainly affiliated with one of the hospital or healthcare systems, but there are certainly others who have independent offices, and we want to work with them. And another critical relationship, partnership to focus on is working with the Banner Health Systems, with them now moving in, or I shouldn't say moving in, but joining us, as well as the relationship, the partnership that we're going to have with University of Colorado Health. So I'd say those are two of the key focuses.
Good. Tess?
Thank you. In addition, because I don't need to repeat, I mean, certainly the district has and should continue all the partnerships that Tracy and Rob just noted. I do think there's also an opportunity to do partnering with all the many nonprofits that provide services for the same population the district serves. And I think the city has some new partnership opportunities that would be worth exploring. There's now an Office of Social Sustainability, and I think there are some very exciting things going on there. And then continued partnerships to create a healthy physical environment in that way with our infrastructure, so that people have sidewalks and things that they need just to live a healthy life. Beyond that, some others that haven't been mentioned yet, certainly Touchstone, the Fort Collins Housing Authority, many other organizations in our community.
You know, lawyers always want to answer a different question. So I'm going to start by saying that partnershiping is generally a good thing when each of the partners can bring a positive piece that's going to result in a benefit to the citizens. So I encourage partnershiping. The obvious partners are going to be other local governments and anybody that is a member or is affiliated with the healthcare community, either at the local, state, or federal level.
Clarissa?
I would like to see the health district partner maybe with some smaller partnerships. I'd like to see more in the school districts where you have teachers and you have nurses, not enough nurses, but these are people that see these families and they really see what's going on in our community, and they can branch out and let these families know that the health district is here and it's available. And I'd like to see it in my nursing homes. I see so many people that aren't aware of what is out there and what can help them. And so I would like to see maybe some more legwork on a smaller level. I think it would really make a big difference in the long run.
Okay, good. The next question will start with Rob. And this one is, how might the Affordable Care Act improve health outcomes? And what positive outcomes and challenges do you envision related to the Affordable Care Act?
First of all, certainly the Affordable Care Act is going to provide the basic health care needs and requirements for many more citizens than are currently covered. And in addition, the expansion of Medicaid is going to also aid people in getting the health care needs that they require. One of the issues that's already been mentioned just with Medicaid is this Medicaid expansion is the fact that there are still limited numbers of doctors that are willing to work under the program. And I think there are still a fair number of unknowns with regard to how that's all going to play out. Specifically under the Affordable Care Act, preventative care, there's absolutely no question that is critical and crucial to long-term health and to minimizing all of our costs. It's been mentioned the most expensive place to get health care is emergency rooms, and sometimes that's accidents, of course, and sometimes it's circumstances that should have been covered under traditional health care, and for whatever reason, the people did not go that route, and it just raises the expenses for everyone. Lastly, we have to be mindful of the increased costs and expenses that are inherent in these types of programs, and I think that's going to be one of the most important things moving forward is to really focus on the balance of providing the health care while minimizing the costs, or balancing the costs. Thank you.
Good. Tess?
I think there's a lot of positive things. I think there's certainly going to take some time for all of it to shake out. As everyone has mentioned, the expansion of Medicaid, it's going to be easier for people to shop for insurance plans. The fact that people can no longer be denied for pre-existing conditions, I think will have positive outcomes for those who wouldn't get care otherwise. And as Rob mentioned, the prevention services are huge. The biggest concerns that I see have to do with the fact that if all of these people are covered, but there are no providers willing to provide the service, or don't feel they can afford the service, then we really haven't accomplished a lot. So I think the district might be able to play a role there to help bridge that gap. And the same would be true for dental care. We really haven't talked much about dental care, but my understanding is that, since Medicaid's now going to cover adults for dental services, we're really going to need to be able to step up the level or the amount of care there and providers. And lastly, I think for the short term at least, people may see a rise in their premiums for employers that are passing along costs. And so we may see the impact in terms of our fee structure at the health district there.
Mike?
Thank you. I think there's two features of the Affordable Health Care Act that I find attractive. And the first is the access feature that's making it accessible to more of our community and our citizens. The second feature I like is the proactive piece, the preventative health piece, the having people look at their health in the long term with a long horizon and take actions currently. The other piece that I like personally is the new emphasis on mental health issues.
Good. Clarissa?
I'm excited to see that healthcare is now starting to require basic coverage for everyone. Mental health, women's rights, and with birth control and such. And I like that is now just the way it has to be, instead of companies deciding what can be covered and what cannot be covered, insurance companies deciding what can be covered, what cannot be covered. I think that's really great for our community. I think it's great that they are required to take people with pre-existing conditions. And I really think it's important to remember that it is the law now. And so I get frustrated sometimes with like all the debate about if it's right, if it's good, if it's bad, if it's wrong. And I'd like to see that discussion change and focus on how we can make it better and how we can make it what it is, because it just is what it is now and it can't go backwards. So what can we do to make it go forwards the best we can?
Tracy?
Yeah, I mean, echoing what everybody else said, and I think it's exciting that we finally have something in place that really puts an emphasis on prevention, which we haven't really ever had before. The health district is obviously involved in primary prevention, secondary prevention, tertiary prevention. I think the primary and secondary prevention pieces will continue to be important even as we fund and cover more of that. But we might have to lean more on our tertiary level of care, of access, again, because of like what Tess said about Medicaid and expansion and people falling through the holes. Thinking about the Affordable Care Act, I think in general, and thinking about quality of care, cost of care, and access to care, and balancing all three of those. As we think about increasing access, how do we balance that with increasing quality and decreasing costs? Because it's the Affordable Care Act, right? It's supposed to be affordable. And I continue to think about that, how we're going to balance those things. So I think it's going to be a complicated road. I'm excited about the end point, hopefully. I think in the beginning it might be a little rough, but hopefully as we move forward, prevention will prevail, and that'll be sort of what guides us. So.
Okay, good. The next question, we'll start with Tess, and this is going to be a little more complicated because I'm combining three questions, so you might, if you have a piece of paper and a pen, you might want to make notes.
Holy moly.
But I can keep repeating as well. The district has a role in supporting policy and supporting legislation, and it has had that role for a long time. And there are three policy issues that folks in the audience have asked about, and I'm combining those so that you can respond to all three at once in the interest of time. One has to do with spraying for mosquitoes to control West Nile virus. The second has to do with the legislation regarding distracted driving, particularly hands-free driving, and whether that is something that needs to be implemented. The third has to do with a bill in the legislature that proposes to increase tobacco purchases from 18 to 21 years of age.
Say that last one again.
So the question, it has to, there's a bill in the legislature, HB 14, must be SB 14, that proposes to increase the age at which you can buy tobacco from 18 to 21. So on all of these, the question is, as a member of the board, you don't have to say you have a position, but you could either say what your position would be or how the district might go about coming to a position on any of these issues. So spraying for West Nile, distracted driving, particularly handheld devices, and tobacco age moved to 21.
Okay, in a minute and a half, huh?
Go for it.
Okay. As a framework, I would say that, whether or not I have an opinion on any one of these, what I have not seen is the health district staff's analysis. And so I would only have a piece of the picture as far as offering an opinion. And I also would note that the spraying for mosquitoes issue is a local. The other two are bills currently in the state legislature. As far as the first one, spraying for mosquitoes, I'm probably a little too close to this. I actually ran the initial task force that looked at this for the city of Fort Collins. I have great faith in the advice we've gotten from the citizens and the technical advisors. It's a very complicated issue. I think the city does a good job of mitigating as best they can and only has sprayed under extreme circumstances. And our health department director, Dr. LaBailey, is ultimately the one with that decision-making authority. As far as the other two bills, the hands-free driving and the bill that proposes to raise the age of tobacco, I would want to see the analysis before I'd come out. I know that the district board strongly supports hands-free driving, but they don't support the existing bill because it doesn't go far enough. I'm not sure what position the district board has taken on the proposal to raise the age of tobacco, but I have worked with state legislatures. I did that for 3 years, and I'd love to, bend their ear and talk to them about it as well.
Good. Mike? And at any time, I can repeat the question.
I'm good. One of the nice things about the health district and about policy making is you can start with a presumption. And the presumption is, if this is going to make our citizens healthier and happier and our community healthier, we start with a presumption of yes. And then you do your analysis to see what resources it takes, what other side effects it might have, what impacts it may have on other citizens and other local governments. And then you get the advice of the professionals in your district, and you make a decision. But I think when it makes people healthier and happier, you start with a presumption of yes.
Okay, good. Clarissa?
I agree with what these two had to say. My personal opinion, since you guys want to know my opinion, I don't really have necessarily a strong opinion on mosquito spraying. I do have 2 young children, so if the mosquitoes are bad, I guess I would prefer to play it safe. However, I don't know enough of the benefit versus risk versus cost. I'd need to see that. I believe something does need to be done with the cell phone use and with hands-free devices or no cell phone use allowed while driving. Something needs to change that way. I'm super passionate about smoking. I just see so much negative health impacts within my work every single day, and it's so expensive. And there are so many people that have started smoking when they are so young because they see it on TV or their parents do it and they just don't know better. And I think that would be very beneficial to make it just a little bit more difficult to start smoking early.
Tracy?
I think with the spraying of mosquitoes, thinking about it from a public health viewpoint, I think it is important that we continue to do that. I think there's individuals who don't want that to occur, but I think we have to look at the greater whole and think about how it benefits the whole, and that's what we think about when we think about public health. In terms of the distracted driving, as Tess said, I agree. I think that the way a bill is written, you have to be careful about, it sounds good. I want to say, yeah, let's get rid of people using their phones while they're driving. But the way it might be written may not be exactly what we're after, and it could actually persuade people and make certain things seem safer or not safe than they are. So I think that's something we'd have to really think about, how something like that would be written. And that's, I think, what Tess was alluding to. In terms of the tobacco, again, it would be interesting to see the data on that. I've just been assigned to be on a tobacco task force for the university, and we haven't met yet, so it'll be interesting to see where that goes. But I think the harder it is for people to access tobacco or any types of hazardous health materials, the better it probably is for the good of the whole. So I think that might be a good thing.
Rob?
I concur. First of all, for the district's role, we certainly want to have a blend of our experience. Whoever, for those that serve on the board currently, continue to serve on the board, as well as those that are elected, it's a blend of our experience as well as public input. The spraying for mosquitoes, Tracy had a very good point. You do have to focus on the greater good. I thought that all in all, the city did a fantastic job of advertising it and executing it this last time, but I know there are concerns, and I think that's something we definitely need to take into account. As far as the distracted driving, this was also mentioned, but there's no question that a lot of legislation that is drafted either does not address the issue it was intended to address, or it addresses that issue, but then also goes in a completely different direction or goes way too far. So, I mean, there's no question, there's plenty of documentation that it's become almost as bad, if not as bad, as drunk driving. So it's certainly something that needs to be addressed, and I think it's a key issue for the district to take into account. And as far as the tobacco, certainly I think that an increased age for purchasing will hopefully reduce people who start smoking at way too young an age and way too impressionable of an age. Thank you.
Okay, the next question will start with Mike. And the question is thus, from the audience. The health district was established in 1960. It owned and operated the Poudre Valley Health Hospital from 1962 to 1994. How will the health district work equitably with Poudre Valley Hospital and Banner Hospital, which is coming to Fort Collins?
I need you to say that again.
The
You already-
background
I got the
you've
history
got.
piece.
So the question is, how will the health district work equitably? And I think the intent here was, how could it work with both hospitals in a positive way? With Poudre Valley, which is now part of the University Health, and with Banner Hospital, which owns, of course,
I'll give it a whirl.
okay.
So I think from the point of view of the Board of Directors of the Health District, you have to start with what is our mission, and that's where we have to begin our analysis. How do we work effectively, other than just trying to be nice people and respectful, is we need to keep our mission in mind when we're dealing with them and understand that they have responsibilities as well. And hopefully, the result is going to be success for our community. I don't know if that answers the question or not, but that's what I got for you.
Clarissa?
I think it's important to be available. It's important to be open-minded. I think it's super important to be respectful and to be considerate to each other, or nothing ever gets done. And I think as long as both sides of the party, PVH, Banner Health, the board, the health district, everybody is willing to communicate with each other and willing to be open-minded and willing to listen, I think tons can get done.
Okay. Tracy?
Yeah, I agree. I think, I guess based on the history, we know that there's substantial revenue that does come from the University of Colorado Health. It also comes from the property taxes as well, I know, but I don't know how that will look, actually. I don't know, with Banner coming in, I think anybody who's interested in health is going to be an important player in our community, and that would probably answer that question about partnerships. There'll be another significant partner, but how that looks, I couldn't answer that yet. I wouldn't know how that will look.
Okay. Rob?
To start with, the Health District Board has a job description, and kind of playing off a little bit of what Mike said, the summary of responsibility discusses the fact that our number one responsibility is to develop the mission statement, vision, strategy, and values. And so we would want to take that into account. And the other thing that's also been mentioned, of course, is the importance. I mean, our goal, everyone involved here and the different hospitals, we want to bring health care to the citizens of the health district. So, and fortunately, it's kind of a recent trend in the healthcare landscape in America, but collaboration is becoming more and more common, and I think it's being understood that how critical it is that we do all work together, because the bottom line is we all have the same goal in mind.
Okay, good. Tess?
I would echo everything that's been said, especially, about our end goal, which is to improve our community's health, and therefore the need to collaborate. I guess the only thing I would add is, because of the fact that the health district owns the land under the University of Colorado Health's properties, we have a formal agreement with them, and we're able to stay on top. There's a health district board member who is charged with attending and being part of that system's board. Whether or not we need to create a parallel structure with Banner, I have no idea. However, there might be some value in exploring a more formal relationship so that we can be equitable and we can just stay on top of what's going on.
This is a thoughtful one. In the event of a change in resources, either up or down, how should the district adjust its services? And with that one, we're going to start with Clarissa.
I think it goes back to the very basic, fundamental reason the whole health district is here. You need to look at the community. You need to see what the community needs and what is lacking within the community, and really focus the financial resources where it needs to be, where the greatest number of people will benefit from it, either up or down.
Tracy?
Yeah, I agree with that. You'd have to, right, where the greatest number of people are going to benefit is going to be the most important. I think, again, that community health survey is going to let us prioritize with the current funding where things will go. So if that's our priority and we get more funding, then we kind of have that as our guiding template that we can go back to. If we lose funding, again, you have that prioritized, and probably things that are towards the bottom would be the things that might go based on that survey. Yeah.
Okay, good. Rob?
Yes, certainly, as was mentioned, I think that the latest health survey would be an excellent place to start, no matter which direction the funds might change, because that's going to give a good idea of what the people of the health district would like to see. The second thing that I think is really, and that'll cover community needs, of course, and then, as mentioned earlier, no matter what the circumstances financially are and the resources, we want to minimize disparity of the healthcare offerings in the community to the greatest extent that we can. And I think that would be one of the key focuses if we were able to have or were forced or able to have a large difference in economics.
Okay, Tess?
Again, I would agree, especially with the point about the disparity. You know, the health district does serve people who are low income and who are unable to access the services through any other means. So I would hope that we make a data-driven decision and focus on the gaps, the people in our community who aren't able to access other services. But again, it would have to be data-driven. The board has a strategic plan that they develop on a regular basis, and I think there would need to be just an awful lot of thought into not only, again, we're kind of focusing all of us on if resources shrink, but if resources expand, how are we going to use those dollars wisely? Because these are public funds, and people have a rightful expectation that they're going to be used responsibly. And so I think we need to just be really careful with that.
Good. Mike?
Changes in resources, that's just a matter of fact that governments face. One of the delightful pieces of local government, like the health district, is they can be more agile in how they deal with it. I think for members of the board, one of the important pieces is not to be too fixed in your opinion, that you be open to change, that you be open to being creative in how you approach those issues, with the ultimate goal being the greatest healthcare bang for your buck to the most people in our community.
Okay, good. Good. And I think we have time for one more question. This is one of more your personal style as a board member. What can you, as a board member, do to educate the community about the purposes of the health district and the services that it provides? And that one, we're starting with Tracy.
So what the board does, what the health district does
What you
as the board
personally
member.
would do as a board member to educate the community about the purposes of the health district and the services it provides?
Yeah.
What role would you play?
What role would I play? Well, I love public health. I mean, that's my training. That's what I do. I would be I talk about it quite a bit in my classroom already. So I would continue to talk to the students about it, both at the undergraduate level, the graduate level, CSU community in general, and that's a big part of our community. For sure, I would advocate it there. And just, I mean, so that's probably the best way I'd answer that.
Rob?
The personal style that I think is most relevant here and what I've got a lot of experience in is I work a lot with entrepreneurs and small business owners, and one of the things that I really enjoy is taking really complex concepts, ideas, legal theories, and helping them, my clients, to understand in plain English what we need to do and why it's important. I really enjoy, I do a lot of work with the Rocky Mountain Innosphere, the incubator on Vine Street, and I work with some brilliant engineers who cannot begin to comprehend why business structures need to be set up this way or what risks they're facing. So my personal style is to really take what can be complex ideas and concepts and just putting them into plain English. And I've also got a very strong background being an in-house attorney for a number of years with working with very diverse audiences, both in a education level and also in their background level. And so I think it's very important to just focus on delivering your message directly to the audience.
Tess?
I feel like I've already started on this journey in some ways with this election. I am not a healthcare expert. I've spent my whole year, my whole career in this community doing a variety of things having to do with municipal governance. And the biggest question I've gotten from all the people I've talked to is, well, what exactly does the health district do? And what exactly is it? And there's a lot of confusion out there. So it's really been fun telling people about all these awesome services and these great people that are out there doing these wonderful things with their tax dollars. And a lot of people don't seem to know that the district exists. And I've certainly gotten an education just in, deciding to take on this journey. And so I look forward to continuing that and maybe trying to, instead of preaching to the choir, those who are in the health industry, I think that what I could do is help spread the word beyond and into the broader community, because I think it's an awesome organization.
Mike?
That's really the fun part of being on the board of directors, is you have sort of your core business function of operating the district, but the fun of it is being an advocate for the district, taking what we do and spreading the word to the community. The flip side of that, I think, is even more fun, and that's being an ear to the citizens of what they think the health district should be and what we can bring to that district. So I think it's got two pieces, being an advocate and also being a good listener.
Clarissa?
I think communication is key. I think it's important that whoever is on the health board, who is currently on the health board, anybody that works with the health district really gets out. They really make themselves part of the community so that people can come and ask questions and get help. And I think it's really important to listen, and I think it's important to not be judgmental. A lot of people that may need services the most with the health district may not be able to communicate their needs or their questions quite as clearly as a lot of people here can. And it's really important to look between the lines and to see what they need and what they're asking for and to do the best you can to help them.
Okay, good. I think we're pretty well used up our time for the questions, so now we're going to move into your summary, which you're allowed to do a 1-minute summary to the audience. And I guess we're going to start with Rob.
Thank you. So I'd just like to say I really enjoy working with diverse teams to achieve positive results. I think some of the key items that have been addressed tonight is, of course, trying to minimize the disparity among the various residents of the county. Also, we certainly want to increase the access to the health care. Partnerships have been and are clearly going to continue to be very key towards the direction the health district goes, as well as just how healthcare is delivered in northern Larimer County and northern Colorado. And last, I think that with all the changes that are going on, one of the board's key focus is going to need to be balancing the delivery of healthcare with the costs and available resources that we have. Thank you.
Good. Tess?
I guess I would just close by saying that I really love this community. I think the mission of the health district, that of ensuring that we're a healthy community, there's nothing higher. And I've got a lot of experience as a community member, as a professional, and as just someone who cares in bringing people together, analyzing issues, building consensus, making hard choices when we need to. I'd like to continue that, and I think I could contribute in a leadership position with the district, and I'd like to have that opportunity. Thank you.
You know, today in the paper, I saw the results of a well-being survey. And Fort Collins was #1 in the country. And I looked at their rubric for measuring that, and two of the components were the physical health and the mental health of your community. And when you think about that, that health really drives the vitality of the community with regard to economics, cultural issues, education, and to have a chance to be part of the health district that I think feeds that good thinking is a wonderful opportunity. I also think I have a good sense of the relationship between a governing board and a policy-making board and the management of the organization. And I think that sensitivity is important, and I'd like to have the chance to bring my energy and thinking to that process.
Clarissa?
I love my job. I love Fort Collins. I'm so passionate about advocating for those that are unable to advocate for themselves. And I'm really excited about this opportunity, and I'm excited to be able to perhaps be part more of the community and to put myself out there so that people will be able to ask me questions and I can help them. And I think it's a great opportunity. I'm so excited that really there are 5 people running, because it's great that there are people that want to do this. And I love that you guys all came out, because there are people that you guys are interested in your community, and you don't always see that. And I think we're very lucky to live in Fort Collins and that people do care so much. So,
Tracy?
Yeah, I think being part of a leadership team, I mean, in terms of summarizing what we talked about, I think the core parts of public health, which this leadership team would enable us to do, including assessment, evaluation, implementation of community-wide programs, policy development, all of the things that we've discussed are things that I feel like I've got quite a few skills to be able to help with, and I'm excited about. And building those partnerships and understanding about resources and where we'd cut and where we wouldn't cut, and really getting into the meat of the data and what the community's saying are things I'm very excited about. So,
Good. Please give our candidates a round of applause. Again, voting for the Health District is by May 6th at the locations we noted before, or you may request and obtain a mail-in ballot through the healthdistrict.org website. You must be a voter within the boundaries of the district. The district boundaries stretch from Jackson County line to the west, the Weld County line to the east. The northern boundary is the Wyoming state line, very big district, while the southern boundary runs roughly between the cities of Loveland and Fort Collins. It's a little complicated. You'd have to look at the map. The League of Women Voters thanks you for attending tonight, urges you to vote in this important election and in all elections. There's information about the League in the back. Please consider joining. We think the League plays an important role in community involvement in our elected environment, and we welcome men and women, and we welcome new members. So good evening and have a safe journey home.